the whole world is being confronted with epidemics, and most importantly, transfer of diseases from animals into man because of the invasion. And so it is something, so Ghana is not very unique as far as this is concerned. Today, I'm going to take you through the cases that we are looking at. That is Marburg Virus, which is the latest we are dealing with. Update on COVID-19, the cases, epidemiology, and the vaccination. The monkeypox update, and you are aware that monkeypox have been declared yesterday as of public health concern globally. And so we all need to be on the lookout to see where we are as a country within that context. The COVID-19, as we are all aware, has presented us with a major challenge, and that has stressed the public health system in this country. The current wave of the COVID has seen, however, a downward trend compared to our neighbors, and in the last few weeks, the numbers have significantly come down. We hope that it continues that way, and we'll come up with measures that has to be done to continue the downward trend. We are further stressed with others like the Marburg, the monkeypox, and of course we're still dealing with COVID. And there have been other pockets of the usual outbreaks of poliomyelitis, because we found some viruses in our sewage environmental district. That will mean that we need to sit up and quickly protect our children. There's some few cases of yellow fever and measles, which are all minor, which has been actually been taken care of, and we are continuing to engage that. Now, let's turn our attention to Marburg now. On the 26th of June 2022, we identified a case of viral hemorrhagic fever. That is a case of fever with bleeding. That's the broad definition from the various orifices. Noguchi confirmed the virus was a Marburg one with Marburg virus disease on the 7th of July. In line with our protocol of quality assurance and the fact that Dakar, Institute Pasteur Dakar is the expert area in terms of hemorrhagic disease, we sent samples to Dakar on the 15th, and the results came on the 15th July that one was positive, one was not corroborated, as the second case was not fully corroborated. Well, we manage them as positive anyway because we have a positive case from Noguchi. That is, they gave us the first two. For the second case, a follow-up of the case, the clinical notes does not fully suggest that a viral hemorrhagic fever. He was a case of chronic peptic ulcer. And so further investigation is being conducted to do an additional test because the body has not been buried, and then we'll continue to see whether we can confirm that or not. All the contacts of Marburg, as we started originally, have completed, as the 118, have completed a 21-day quarantine, which is a mandatory quarantine that we follow up. And we've also implemented interventions focused on the three regions, which I will show you. That's Ashanti, Savannah, and Western region, where 3 districts in that area. We have had a cumulative contact list of about 318 contacts in the 3 regions. Ashanti had 50, Savannah 48, and Western 20. 19 of the contacts were health workers, 99 were close family members or household or community contacts. And all contacts, as I said, has completed the 21-day as we speak. So if you see the map there, we have the solar tunnel Kaaba, which came into view because in the early phases, the first case was sent there and buried. And so during the burial, and we had contacts there to look out for. We also have the Adansi North and to some extent Bekwai as the area of concern in Ashanti region. And then we have Western region, that's Pristia Huni Valley district, which is where the first case fell ill and came from. And so that's our main source of concern, that they may have been the source of the infection, because the person was ill there before moving to Adansi, where within 3 days the system picked it up. Unfortunately, one close contact reported symptoms after the maximum incubation period. That was after the 21 days, reported some symptoms and died on the 21st of July 2022. This, I mean, for the sake of the family, these are very, very close relatives or members of the deceased, where under normal circumstances they are higher risk. But what is interesting here is that it came after the 21 days quarantine. So we've taken samples and following up with them. Currently 40, so because of that, the initial test had come up as positive for that close contact. And we have identified 40 additional contacts within the Savannah region where the incident occurred. 11 of them are health workers, and 11 out of the 40 are health workers, and the rest are other new members, including patients. Well, after the time, the patient had been discharged from quarantine, but we're still monitoring to see. Daily temperature in general health and well-being is being undertaken by health workers in the affected districts on daily basis. So we have instituted additional public health measures. These are, we have alerted all districts in the country to be on the lookout. And I must say that it's a very, very high sensitivity area. So we had a couple of cases that come close are tested, but they are so far, we've had no positive outside these places. We've also the community engagement and risk communication, education on what to do, what not to do as part of the protection has also been done on, and then further investigation continue to go on to look at the main source of the condition. We've also constituted a rapid response team with the support from the regional and district response team to detail the investigations that are going on. We have looked at the clinical records. What we do is that we go to the facility in the area, look at anybody who has come there, because it could be missed, with symptoms that come close to that. And then we look at it. But so far, everything is fine. That's apart from the 2 cases, we have not had any one that comes close to that. We are also supporting them with contact tracing, and we have supported them with PPEs and other logistics to ensure that they are able to conduct their work more efficiently. We have developed training tools and education materials, especially for the district of concern, the region. We are training more surveillance, community-based surveillance. These are the people who hear somebody is not well, somebody is vomiting, etc., and tell us. So those are very, very key tools we have in identifying cases. We've trained about 60 community-based volunteers across the country, and more additional training continues to go on. And then we've also developed a national response plan to deal with the Marburg disease. We have identification of community of interest in the listing of contacts. We've heightened community-based surveillance, as we said, and district-based orientation of health staff and standard case definition. That is, the case definition is what are the things that you will see that will make you draw the conclusion that we will need to take a second look at this person to make it much simpler for us. We are also doing public sensitization through radio and community-based services, including this very update that we are going on. Further investigations will continue. As we continue with the further investigation, we are going to enhance community engagement, because that's very, very important that we are able to pick it up early. And I must emphasize that the key to addressing this is early identification, so that that person or whoever cases does not spread it before you start chasing the cases. And that has been the strength that has helped us identify it so early, and in 21 days we still are where we are. We have decided that we are going to continue monitoring all contacts for 42 days, just to be on the safe side. Offer psychosocial responses, support to their families, and it is very distressing. Of course, not everybody will believe that there's a virus called that, but they also think that, is it a curse? Is that something from where? And so we are giving them support in all aspects to ensure that the community stays safe and they are able to follow the contact tracing arrangements that we are doing. We are training community-based cases to do search and contact other contacts to be traced. And then we are going to do an environmental assessment of the wildlife affected district, that is Adanse North, Bekwai, Pristia, Huni Valley. As we said the last time, it is the fruit bat that is the main host of the virus. The bat can live with the virus without falling sick. But if he jumps into a human being or a primate like the large monkeys, etc., then it becomes a problem. And so we are looking at that. And we are collaborating with wildlife to ensure that we are going to do a national risk assessment to see, are there any other places in the country where surveillance must be enhanced, because the risk of contracting that virus is high. And so this is just an eye-opener, and we are using that opportunity to also build our systems to be able to respond early, irrespective of where the threat may come from. We suspect that the virus may be lurking around the sub-region, and so everybody needs to be very careful. And our bats migrate and come back, and so we need to watch all those things. Okay, so that's it for Marburg. I'm sure we'll have a few more questions from that. So going back to COVID, which is still remains a threat. And as you have seen, other countries are seeing increasing cases with a new variant, the new Omicron variant in other parts of the world. But we have seen a decline in the last few weeks. Greater Accra still remains the region that accounting for the highest proportion of the reported cases nationally. Apart from yesterday, where I think Central Region had a higher number than Greater Accra. COVID-19 among those arriving international are still very, very low. 4 regions, Western North, Northeast, Savannah, Upper West, do not have active cases at all. We've had 12 deaths reported between the 1st of June to date, and 6,198 cases have been recorded over the same period. So the active cases now has dropped to about 336. Currently, we have only 1 severe case, but there's no critical case in the country. So you can see that this is the normal, usual graph. You can see there's a downward trend now, and this was a relatively lower curve than the previous Omicron one. And the active cases continue to drop as usual, and so we'll not spend so much time there. Now, total vaccines administered. May 31st, we had about 15.9 million. As at June 30th, we had about 17.4 million doses given out. And as we speak, as at July 20th, we have moved about 18.4 million doses across the country. And the last time we showed you this chart of regions with the lowest coverage. The yellow ones are those who are doing less than 25. You can see that May, June now, in the last one, there's no yellow map in any of our regions. So that's a good sign that uptake is increasing with the periodic campaigns that we are doing. If you go to the next slide, you can see that there were a lot of yellows in the districts. That has reduced significantly in June, and in July, as of July 24th, the number of the yellow slides have significantly come low. We have seen that our parliamentarians have also joined the campaign, ensuring that people will take up the vaccine. I think that will be very, very helpful for us. So that's it for the vaccine uptake and COVID. Finally, Honorable Deputy Minister, I want to also finish with monkeypox. As we are aware, WHO has declared it as public health emergency of international concern. Ghana has so far recorded about 34 cases. The last confirmed case was on the 15th of July. After the last breakdown, we had about, of the 30, we had the first 30 we had about 20 of them from Greater Accra. We have one in Bono East, Bono Upper West, and Ashanti region. So these are the regions who are reporting cases. So far, no fatality among cases have been reported, and the majority of the cases are males. So you can see with a chart, the map showing where the cases really are. We have them in Upper West, Bono East, Bono, Ashanti, Eastern, and Greater Accra. Greater Accra accounting for about 2/3 of all the cases that has been reported. So district rapid teams, as usual, and case management teams have been oriented on how to identify and make a response. We have also disseminated WHO guidelines on case management and how to do when you have a case of monkeypox. We are working with the Veterinary Services Department to conduct assessment in affected communities to look for what are the possible causes so that we can identify possible contacts and those at risk and protect them. Contact tracing and follow-up, and we have enhanced education in schools and communities as far as monkeypox is concerned. Very easy to mix it up with chickenpox, and I think so education is extremely important. So what is the outlook for us? The public health system is currently being strained and stressed with all these emergencies that is coming up, but I must say that the system is holding, and thanks to the community and the system that are in place, is happening. I think the only trump card, the main trump card we have here is the fact that the system is able to pick up things very, very early than, and I think we may have picked the first monkeypox even before the announcement became a public health emergency as was on. The risk of widespread monkeypox exists but has not posed a major threat. The threat of Marburg virus that will spread exists, but is very low. The chance that it will spread is low because we've done since the 26th of June up to now. If it was going to be an explosion, well, we should start seeing a spread from those initial contacts who may have passed it on to others. But like I said, the risk is there. The host is in the country, and so the possibility that it can be jumped into anybody is important. So we continue to be on the lookout for that. So to look at that is to prevent all that is adherence to protocol is extremely important, and infection prevention and control strategies, including personal hygiene. Marburg is a close contact. If you don't come in touch with flu, body flu, etc., you won't get it. And so how do we look at that? And we must also commend our health workers in the fact that when they encounter the case, because of the infection prevention approaches they have so far, we've not had any health worker who has been affected. Usually, such cases is the case, and the next batch of people who makes affected are the health workers, the first responders who are going to look at them. But in this case, we have so far not had any condition appearing from them. The surveillance activities will continue to be strengthened so that we can make sure that early detection and adequate containment is assured. So thank you very much.